Imagine waking up tomorrow, looking in the mirror, and realizing that the exact physical trait you've been, quietly, deeply insecure about your entire life is actually considered the ultimate symbol of supreme intellect.
Right, like absolute biological perfection.
Exactly. And imagine that the guys who have the physical traits you've been desperately wishing for are actually viewed as, I don't know, foolish, barbaric, and just completely out of control.
It sounds like this bizarre fantasy, but if you teleported back to classical ancient Greece, that is exactly the reality you would step into.
Yeah, which is wild.
It really is. The societal ideal for the male body back then featured a very small, modest penis. That was literally the hallmark of a civilized man.
A philosopher, basically.
Yes, a leader who was governed by rationality rather than primal urges.
Which is just the absolute inverse of today's culture. And, that wild historical flip perfectly sets the stage for what we are doing today.
It really highlights the contrast.
Because today, we are taking a subject that is totally shrouded in historical myth-making, intense locker-room curiosity, and honestly, for a lot of people, a very persistent, heavy anxiety.
Oh, absolutely.
We are diving deep into the medical, functional, and psychological realities of penile health.
And we are doing this by deliberately stripping away the predatory marketing hype.
Yeah, there's so much of that out there.
So much. In a digital world that's completely saturated with camera tricks, impossible standards, and, aggressive advertising targeting men's insecurities, we have to ground this conversation.
Right. Grounding it in actual facts.
Exactly. Strictly in evidence-based medical science, evolutionary biology, and clinical data.
So to you, the listener, whether you are tuning in out of just biological curiosity or maybe trying to understand a medical condition or just looking to navigate the absolute mountain of misinformation out there, we see you.
We definitely do.
We are moving way beyond the simplistic, frankly, adolescent obsession with rudimentary size measurements.
Which is what everyone focuses on.
Right. But we are going to unpack the true biomechanics of the body. We're looking at conditions like Peyronie's disease, the cellular reality of regenerative therapies, traction devices, and what genuinely biologically predicts sexual satisfaction.
The real science.
Exactly. So, okay, let's unpack this. And we have to start with the fundamental way we view the human body. We really have to stop looking at male anatomy as just like a static ruler.
That is the crucial first step. I mean, it is not a fixed piece of wood.
Right.
It's a highly complex, dynamic biomechanical system. It's an ecosystem, really, that responds in real time to cellular signals, blood flow, temperature changes, and profound psychological states.
It's constantly changing.
It is. But before we can discuss medical enhancements or physical anomalies or the cutting edge of regenerative science, we really have to define what normal actually means.
Because the internet has basically taken the concept of average and completely obliterated it.
Oh, totally destroyed it.
You go online, and suddenly you feel like if you aren't carrying around, 8 or 9 inches, you are somehow failing at biology.
It's a massive distortion.
So let's look at the baseline. What do the massive, global, clinically verified averages actually say when you remove all the self-reported bragging?
Well, the most reliable data we have right now comes from a highly cited clinical meta-analysis.
Okay.
And this study aggregated measurements from over 15,500 men across the globe.
Wow, that's a huge sample size.
It's a massive, highly scrutinized data set. And the hard data reveals that the average erect length is 5.2 inches.
Wait, 5.2?
AS,
Yeah.
or 13.12 centimeters.
5.2 inches. I just want to pause on that because I think that number alone is going to shock a lot of people.
It usually does.
I mean, 5.2 inches is roughly the length of a standard, maybe slightly older smartphone. It is not the massive forearm length anomaly that popular media constantly portrays.
It is not.
Yeah.
And the data plots out on a standard normal distribution curve, a bell curve, essentially.
Okay.
The vast majority of the human male population falls between 4.5 and 5.8 inches.
Got it. And what about girth?
When we look at girth, the average erect girth is 4.6 inches, with the standard range falling between 4.2 and 5.0 inches.
Okay.
But what is clinically vital to understand here is that an estimated 95% of men who actively worry about their size...
The ones carrying genuine distress.
Exactly. They fall perfectly into this medically normal, healthy, highly functional range.
Wait, 95% of the guys stressing out about this are completely normal.
Completely normal.
That means almost the entirety of this cultural anxiety is built on a phantom standard. It's insane.
It is. It's a culturally manufactured panic.
But I have a serious question about the mechanics of this data collection. How do researchers actually measure this objectively? Because human beings are notoriously terrible at self-reporting.
Oh, they are the worst.
Right, it's exactly like measuring a fish you just caught. You catch a 14-inch bass, but your brain wants it to be bigger, so you start the ruler a little early.
You push it into the air a bit.
Yeah, you round up, and by the time you tell the story at the bar, it's an 18-inch fish.
The fisherman's tail effect is exactly why clinical studies entirely discard self-reported measurements. They are famously, almost comically, unreliable.
I can imagine.
To give you an idea of how skewed the cultural perception is compared to reality, out of those 15,500 men in the clinical meta-analysis,
Yeah.
not a single one had a 10-inch penis.
Wait, out of 15,000 guys, not one.
Not one. 10 inches is a statistical unicorn. So, to ensure accuracy, researchers rely on a clinical standard called the bone-pressed measurement,
Okay.
and this is strictly conducted by trained professionals.
I'm trying to visualize this clinical setting. How does a bone-pressed measurement actually work to eliminate all that bias?
Well, it standardizes the starting line.
Mm-hmm.
A clinician places a rigid ruler along the top, or the dorsal side, of the penis.
Okay, on top.
Right. They then physically push the ruler past the suprapubic fat pad, that's the layer of skin and adipose tissue at the base, until the ruler firmly makes contact with the pubic bone.
Ah, so you bypass the fat completely.
Exactly. Then they measure to the very tip of the glands.
That makes total sense for standardizing the base, but what about the arousal state? That seems like an impossible variable to control in a sterile, fluorescent-lit doctor's office.
It is, which is why they often don't measure it erect at all.
Wait, really?
Yeah, researchers frequently use the flaccid stretched length as a surrogate for erect length.
Hold on, I have to challenge that.
Mm.
How can pulling on flaccid tissue accurately predict the hemodynamic engorged state of an erection?
I know, it sounds weird.
Doesn't tissue just stretch differently for everyone?
It's a highly counterintuitive concept, I agree, but it comes down to the structural anatomy of the organ.
Okay, explain that.
The erectile tissue is surrounded by a tough, fibrous envelope called the tunica albuginea.
Tunica albuginea.
Think of it like a very thick, somewhat elastic canvas bag.
Okay, a canvas bag.
When you grasp the head of the penis and put it on maximum stretch while flaccid, you are pulling that tunica albuginea to its absolute maximum anatomical limit. When an erection occurs, blood fills the internal tissue and expands it outward and upward, but it can only expand as far as that outer canvas bag allows.
Oh, so it hits a literal wall.
Precisely.
Right.
Therefore, the maximum flaccid stretch is a remarkably consistent and reliable predictor of the maximum erect length. It eliminates the variable of psychological arousal entirely.
Okay, that is fascinating.
It's
The canvas bag has a hard limit, whether it's filled with blood or just physically pulled by a doctor.
exactly.
But speaking of the flaccid state, there is a physiological mechanism that deeply impacts how men perceive their baseline size. And it's something almost no one talks about.
You're talking about the dartos muscle.
The dartos muscle, yes. Let's
That-
get into this.
So the dartos muscle is a thin layer of smooth muscle fiber situated just beneath the skin of the scrotum and the penile shaft.
Okay.
Its primary evolutionary function is thermoregulation.
Keeping things warm.
Right. When the environmental temperature drops, the dartos muscle automatically contracts, pulling the external anatomy closer to the core body heat to protect the reproductive organs.
Okay, so it is the biological mechanism behind shrinkage.
Yes, exactly.
So it's the muscle we blame when we jump into a freezing cold lake.
Yes, but it's not just temperature, is it?
Right. The truly wild part is what else triggers this muscle.
This is where it gets interesting. The dartos muscle is heavily innervated by the sympathetic nervous system.
And that's the network responsible for your body's fight or flight response.
Exactly.
Yeah.
When you experience a surge of adrenaline, stress, or crucially anxiety, the sympathetic nervous system activates.
It goes into survival mode.
Right. Blood is shunted away from the extremities and toward the vital organs and major muscle groups, preparing you to either fight a predator or run away.
Makes sense.
And concurrently, the dartos muscle violently contracts.
Man, this is a massive light bulb moment.
Yeah.
If a man is feeling deeply anxious about his body, or he's standing in a locker room feeling insecure, or he's just stressed about an intimate encounter,
His brain triggers a fight or flight response.
and his body literally responds by contracting the dartos muscle, causing maximum retraction.
Yeah.
The psychological anxiety creates the exact physical state he is terrified of.
It is a self-fulfilling biological prophecy. The mental state directly dictates the biomechanical state.
That is wild.
You really cannot separate the mind from the organ. Which brings us back to that ancient Greek paradox.
Right, the Greeks.
When you understand that the body fluctuates wildly based on temperature and stress, and that the global average is a very modest 5.2 inches, you realize that modern societal pressure is not based on biology.
No, not at all.
It is based on a culturally constructed illusion.
And culture can change. If the Greeks valued small, modest anatomy as a sign of high intellect and viewed large anatomy as a sign of foolish barbarism, it proves that there is no universal, hardwired human rule that bigger is better.
We just happen to live in an era where media consumption has flipped the script.
Precisely. The biological average of humanity has not shifted. Only the lens through which we view it has changed.
Which naturally leads to the next massive question.
Yeah, if the average is 5.2 inches and 95% of guys are hovering right around there, what actually happens when human biology breaks the mold?
When we go to the extremes.
Let's step away from the center of the bell curve and look at the extreme tails. We really need to test this modern myth that massive size equals a better life.
To understand the extremes, we rely on a statistical concept called standard deviations.
Okay, math time.
In a normal bell curve, the vast majority of people fall within 1 or 2 standard deviations from the center average. When we talk about medical outliers, we are looking at individuals who fall 2.5 or more standard deviations away from that mean.
So let's look at the lower end of that extreme first. What does that actually look like?
Clinically, a true micropenis is defined as an erect or fully stretched length of under 3 inches, or roughly 7.5 centimeters.
Under 3 inches, okay.
This is an exceptionally rare condition, occurring in roughly 1 in 10,000 men.
That's incredibly rare.
Very. And it is almost never simply a matter of bad genetic luck. It is typically the result of specific hormonal abnormalities.
Like what?
Like a lack of androgen production or pituitary gland issues during the 2nd and 3rd trimesters of fetal development.
Wow, so it happens very early in utero.
Exactly. And on the complete opposite side of that curve, we have the macropenis.
Okay, and this brings us to the case study of Matt Barr from the Source Stack.
Yes.
And I want to clarify, this isn't some internet rumor. This is a man who was verified by an NHS-affiliated clinical study and who actually had a mold cast for the Icelandic Phallological Museum.
He is a verified medical outlier.
His verified erect length is 14.5 inches.
14.5 inches.
That is almost 3 times the global average.
It is a profound anatomical anomaly. And examining his lived experience provides an incredibly necessary reality check for everyone listening.
Because the prevailing cultural assumption, driven entirely by adult media, is that possessing that kind of extreme anatomy makes you the ultimate winner of the genetic lottery.
A conqueror.
Right. But his reality is fraught with logistical and physical nightmares. Just navigating a normal Tuesday is a strategic operation for him.
Oh, absolutely. Think about basic clothing.
Right. We take basic clothing for granted. He cannot wear standard sweatpants.
No, he can't.
If he puts on a pair of loose gym pants, the sheer volume of his flaccid anatomy creates a bulge so significant that it looks like he is walking around fully aroused.
Which is a huge problem.
That isn't just embarrassing. It can cause extreme public distress, get him thrown out of places, or even result in encounters with law enforcement.
He essentially has to employ rigorous tucking methods just to exist in public spaces.
How does he even do that?
He routes the anatomy backward between his legs, similar to the techniques used by drag queens, just to be able to wear normal trousers.
That sounds incredibly uncomfortable.
It is. And consider physical fitness. Playing contact sports like rugby or even basketball is basically out of the question.
Because of the risk of injury.
Yes. You have an extra 10 to 14 inches of highly sensitive vascular tissue. A standard athletic cup or jockstrap cannot accommodate it.
So any sudden movement or impact is a severe physical liability.
Exactly.
The clothing logistics alone are wild. He said he can't buy underwear at a department store. He has to source from highly niche brands that manufacture extended pouches. And for a long time, he relied on a woman who custom sewed his underwear before she retired.
It is a life of constant literal friction.
Yeah. But here's where it gets really interesting. This completely shatters the cultural myth. Because the sexual mechanics, the exact arena where society assumes he is a god, is actually incredibly difficult.
Because standard penetrative intercourse, in the traditional sense, is practically impossible.
He stated very clearly that they can only utilize a small fraction of his length, maybe a few inches, without causing severe physical trauma to his partner.
Human internal anatomy is simply not designed to accommodate 14.5 inches.
Not even close.
Even oral sex, he admits, is logistically flawed and generally unenjoyable for him.
Because a partner can only interact with a third of it, right?
Right, leaving the rest unengaged and making the mechanics incredibly awkward for everyone
It
involved.
just doesn't work.
Furthermore, we have to look at the hemodynamics, the physics of blood flow.
Okay, let's get into the physics.
The penis is not a hollow balloon. It is a spongy tissue that requires immense vascular pressure to become engorged.
Right.
The blood volume required to achieve an erection of 14.5 inches is staggering.
I can't even imagine.
He noted that it takes a highly extended period of time to become fully erect because his cardiovascular system literally has to pump a massive amount of blood into the tissue.
And during the clinical studies, his body couldn't even achieve it naturally under clinical observation, right?
Yeah.
They had to use intracavernoidal injections?
Yes, they did. They injected powerful vasodilators directly into the erectile tissue.
What exactly do those do?
Vasodilators are medications that force the smooth muscle in the blood vessels to relax and open wide. This allows a massive influx of blood to achieve the absolute maximum state for measurement.
Okay, but in his daily life, this hemodynamic reality means spontaneous intimacy is practically impossible.
It is. He cannot have a quick, spontaneous encounter.
It requires immense patience, massive amounts of foreplay, and careful planning.
And then you have the reality of protection.
Oh, right. Condoms.
You can't just walk into a pharmacy and buy a Magnum condom. It won't even come close to fitting.
So what does he do?
He relies on custom-fit kits like the Myoni system.
How does that work?
It uses a specialized measuring tape to choose from 52 different, highly specific sizes.
52 sizes. That turns intimacy into a custom-order logistics project.
It beautifully underscores the biological truth. Human bodies are designed to interface with the mean, the average.
We are not built to easily accommodate the extreme edges of the bell curve.
We really aren't. But beyond the physical limitations, there is a severe psychological burden for him.
This is where it gets genuinely sad. He faces intense, constant objectification.
Yes.
People frequently assume he must be simple-minded. Because adult media often portrays highly endowed men as unintelligent brutes driven purely by sex, people instantly project that stereotype onto him.
It is a very specific, alienating form of prejudice. He receives highly invasive, inappropriate messages constantly.
People just treat him as a novelty.
Like a sideshow attraction rather than a human being. He noted that if a partner is only interested in him for his size, acting as a size queen and valuing the anatomical novelty over his actual personality, the relationship inevitably crumbles.
Because it's shallow.
Exactly. It is emotionally exhausting to have your entire identity reduced to a single, extreme physical characteristic.
It is the ultimate cosmic irony, the exact physical trait that our modern society worships, the thing 45% of men actively wish they had more of, actually makes daily life, athletic movement, spontaneous romance, and finding genuine, non-fetishized emotional connection incredibly difficult.
It reveals a massive disconnect between societal fantasy and physiological reality.
Huge disconnect.
Which brings us to a critical junction. If extreme size is actually a massive logistical hurdle and 95% of men perfectly fit into the biologically optimal, highly functional range,
Yeah.
why are an estimated 45 to 55% of men walking around fundamentally dissatisfied with their bodies?
It is a silent epidemic of psychological distress. We have millions of healthy, perfectly average men carrying around this heavy burden of inadequacy.
And the data points directly to a severe conditioning issue.
We are looking at widespread subclinical body dysmorphic disorder.
The psychological conditioning is relentless.
It really is.
While mental health professionals are careful to state that adult media alone might not cause clinical body dysmorphic disorder from scratch, it acts as a massive accelerant.
It heavily distorts baseline visual expectations.
Yes, completely.
The phrase from the research that stuck out to me was the unicorns with rulers effect.
Oh, that's a great way to put it.
Right. In adult media, you aren't looking at average guys. You are looking at the 1 in 10,000 statistical anomalies we just talked about.
The outliers.
And they're using extreme camera angles, wide lenses, and shaved anatomy to force perspective and exaggerate size even further.
It's a highly manufactured image.
If you spend your life looking exclusively at unicorns, a perfectly healthy, strong horse is eventually going to look broken and inadequate to you. Your internal gauge of reality completely shatters.
Then what makes this anxiety particularly tragic is the profound disconnect between men and women on this topic.
Okay, let's talk about that survey.
Yes, a massive survey of over 52,000 individuals revealed that while up to 55% of men are dissatisfied with their own size,
Yeah,
roughly 85% of women are perfectly satisfied with their partner's size.
85%. That means the vast, overwhelming majority of this anxiety is totally self-inflicted and peer-driven,
It's men comparing themselves to other men on a screen.
rather than listening to the actual satisfaction of their partners. It is a solitary, unnecessary panic.
However, we cannot dismiss all anxiety as purely psychological.
Right, there are physical factors.
There is a very real physical phenomenon that intersects with this distress, and it is something clinicians see constantly: the buried or hidden penis.
This is a crucial functional issue.
Well,
Let's unpack the suprapubic fat pad, because I think this is where a massive percentage of men actually have total agency, but they completely misunderstand the structural problem.
precisely. For a very large number of men who present to urology clinics deeply concerned about a small penis.
What do the doctors usually find?
A clinical examination often reveals that the core anatomical structure, the erectile cylinders themselves, are completely normal in length.
No.
However, that length is obscured. It is physically buried underneath a thick layer of adipose tissue fat at the base of the abdomen and the pubic bone.
It's simple geometry. If you have a 2-inch layer of fat pushing outward from your pubic bone, you effectively swallow up 2 inches of visible external length.
Exactly. The anatomy hasn't vanished. It's just trapped behind a wall of tissue.
And in extreme cases of obesity, especially when combined with a cold environment and that dartos muscle contraction we discussed,
The penis can retract entirely inside those folds of suprapubic tissue.
for the patient, this has to be incredibly alarming and visually distressing.
Oh, it causes severe panic. But the clinical solution here is not a dangerous surgery, a traction device, or a magic pill.
What is it?
The single most effective, non-invasive enlargement method known to medicine is simply weight loss and physical fitness.
By losing the abdominal fat, you pull that tissue wall back and you reveal the natural baseline length that was there the entire time.
Yes.
But it's not just an optical illusion, right?
Mhm.
The fitness aspect fundamentally changes the cellular functionality of the organ.
Absolutely. If we connect this to the bigger picture, we have to look at the cellular mechanics.
Basically.
The penis is, at its core, a hemodynamic organ. It is a complex sponge relying entirely on healthy blood flow and specifically endothelial function.
Endothelial function, what is that?
The endothelium is the ultra-thin inner lining of your blood vessels.
Okay.
When you are sexually aroused, healthy endothelial cells release a gas called nitric oxide.
Nitric oxide, right.
Nitric oxide signals the smooth muscles in the blood vessels to relax, allowing a massive rush of blood to fill the spongy tissue and create an erection.
So if you are carrying massive amounts of excess weight and your cardiovascular health is poor, your endothelial cells are likely damaged.
Exactly.
They can't produce enough nitric oxide.
When you engage in cardiovascular exercise and lose weight, you aren't just revealing hidden length visually, you are actively repairing the endothelial lining.
You are strengthening the vascular network necessary to achieve and maintain rigid erections.
This makes so much sense. Medical professionals constantly talk about erectile dysfunction being an early warning system.
Yes, the canary in the coal mine concept.
If your tiny penile blood vessels are clogged with plaque or failing to dilate, it is a massive red flag that the larger blood vessels in your heart are likely suffering the exact same fate.
Your sexual health is quite literally a mirror reflecting your overall metabolic and cardiovascular health.
Yes. Taking care of your heart is unequivocally the best intervention for your sexual function, period.
So for the vast majority of men, a combination of mental health therapy to address the media-induced dysmorphia, combined with weight loss and cardiovascular exercise, is the complete holistic prescription.
It really is.
But
Yeah.
we must acknowledge that biology is imperfect.
True.
There are genuine medical exceptions where exercise and therapy are completely ineffective.
Right. What happens when there is genuine physical trauma to the tissue or a severe structural deformity?
This leads us into the fascinating, highly mechanical world of Peyronie's disease and traction therapy.
Peyronie's disease is a distinct, localized medical condition.
How does it manifest?
It is characterized by the development of tough, inelastic scar tissue, referred to as plaques within the tunica albuginea.
Going back to our earlier analogy, the tunica albuginea is that tough canvas bag that surrounds erectile tissue.
Yes.
How does it get scarred? Is it from an injury?
Usually, yes. It is believed to stem from microtraumas, tiny, often unnoticed tears that occur during vigorous intercourse or physical injury. In a healthy body, these microtears heal cleanly. But in men with Peyronie's disease, the healing process goes haywire.
So
It lays down dense, fibrous, non-stretchable collagen. Because this plaque cannot expand when the erectile tissue fills with blood, the erection hinges or bends sharply around the scar.
ouch.
This leads to severe, painful curvature and a genuine, measurable loss of physical length.
For a man dealing with a 40-degree bend and painful erections, losing weight isn't going to dissolve scar tissue.
No, it won't touch it.
They need a structural mechanical intervention. And this is where the biological science of mechanotransduction enters the chat.
It's a great word.
It sounds like a term from a sci-fi movie, but the underlying logic is brilliant.
Mechanotransduction is one of the most elegant, fundamental processes in human biology.
Break it down for us.
It is the process by which cells convert mechanical stimuli, like a physical stretch or tension, into biochemical signals.
Okay.
When you apply controlled, prolonged, gentle physical tension to human tissue, the cells actually sense that physical force.
The cells feel the pull.
Yes, and they respond by upregulating certain enzymes that break down the rigid scar tissue, while simultaneously promoting the cellular division and growth of new, healthier, more flexible tissue.
The analogy that immediately clicked for me when researching this was orthodontics.
That's a perfect comparison.
If you have severely crooked teeth, your dentist doesn't just grab a pair of pliers, yank on them with maximum force for 3 minutes, and expect them to stay straight.
That would just break your jaw.
Exactly. Instead, they apply braces. They use consistent microtension over months and months to slowly signal the bone and tissue in your jaw to remodel itself.
Yes,
These penile traction devices are essentially braces for soft tissue.
that is a clinically precise analogy. Tissue remodeling requires time and consistent low-grade force. It cannot be rushed.
And the clinical studies backing these devices for Peyronie's disease are remarkably robust, right?
Very robust. Urologists frequently review 3 specific devices that operate on this exact biological principle.
Let's examine the mechanics of these devices because how they actually achieve that stretch varies wildly.
First up is the classic, the andropenis gold.
Tell us about the andropenis gold.
It's a traditional rod-based traction device. It utilizes a plastic base ring that rests against the body, 2 extendable metal rods, and a silicone band or noose that physically grasps the head of the penis, pulling it outward.
Okay, pulling it straight out. What does the data say?
A clinical study involving 96 men with Peyronie's disease demonstrated that wearing this device for an average of 4.6 hours a day resulted in a 1.5 centimeter length gain and a 20-degree improvement in curvature.
But hold on, 4.6 hours a day, that is an unbelievable time commitment.
It is significant.
You have to wear this mechanical rig under your clothing, go about your day, sit at your desk, and a lot of users report that the physical silicone clasp becomes incredibly painful and pinches the tissue over those long hours, making it really hard to stick to the protocol.
Patient dropout is a massive issue with traditional clasps,
I can imagine.
which led to the engineering of devices like the Pennymaster Pro.
How is that one different?
Instead of a physical mechanical clasp, the Pennymaster Pro utilizes a vacuum suction bulb.
Oh, interesting.
You apply a specialized lubricating gel, place the glands into a silicone dome, and squeeze the bulb to create a gentle vacuum seal.
So no pinching.
Exactly. This distributes the tension evenly across the entire surface of the glands, preventing localized pinching and greatly improving comfort for long-term wear.
The data for the Pennymaster is impressive. A multi-center study of 93 patients showed up to a 31-degree reduction in curvature.
Which is huge for quality of life.
But the time commitment is still brutal. To see a 19-degree improvement, men wore it for less than 4 hours. But to get that massive 38-degree reduction, they were strapping this vacuum pump to themselves for more than 6 hours a day.
It is basically a part-time job.
Yeah, you really have to be dedicated.
It requires extreme psychological dedication and compliance. However, there is a third option that completely revolutionized the treatment protocol: the RestoreX.
Ah, the Restore X.
This device was developed specifically by medical researchers at the Mayo Clinic, primarily for Peyronie's disease.
And the Restore X abandons the straight pull method entirely. It uses countertraction, right? How does that work cellularly?
Yes, countertraction. Instead of just pulling the tissue straight out along a linear axis, the RestoreX features a joint mechanism.
A hinge, basically.
Right. This allows the user to bend the device in the exact opposite direction of their curvature.
Oh, wow.
By applying targeted tension directly against the localized plaque, the mechanotransduction process is highly accelerated. You are putting maximum mechanical stress precisely where the scar tissue is densest.
And the protocol shift is life-changing. Instead of wearing a vacuum dome for 6 hours a day under your jeans, the RestoreX protocol is just two 30-minute sessions a day for 12 weeks.
It's so much more manageable.
You sit on the couch, watch a TV show, apply the counter traction, and you're done.
And the results from a 2019 Journal of Sexual Medicine study showed an 11.7-degree curve reduction and a 1.6 centimeter length increase.
By drastically reducing the daily time requirement, patient compliance skyrockets, which means the real-world results are vastly superior.
Exactly. But as we discuss these clinical tools, we have to be aggressively clear in busting the myths surrounding them.
Yes, because the predatory internet marketing is highly deceptive. Let's kill the myths right now.
Okay, myth number one.
Myth number one.
Yeah.
These devices work overnight. Totally false. Just like braces, mechanotransduction is a slow cellular process.
You are waiting for cells to divide and tissue to remodel. It takes months.
Myth number two. They are a universal cure-all for anyone who wants to be bigger.
They are not. They are primarily engineered and proven effective for men with Peyronie's disease, or men trying to restore length lost to severe scar tissue from prostate surgeries.
So what if a healthy guy uses one?
For a perfectly healthy man looking for purely cosmetic enhancement, the gains are exceedingly modest, perhaps a centimeter or two, and require intense daily dedication for very little reward.
And myth number three, which honestly terrifies me. The idea that applying more tension equals faster results. Guys think, if 1 pound of pressure takes 6 months, I'll just crank it up to 10 pounds of pressure and be done in a week.
It is a critical, devastating error. Applying excessive tension does not speed up cell division. Biology has a speed limit.
Right.
When you apply extreme force, you cause ischemia, a complete restriction of arterial blood flow to the tissue.
The cells are starved of oxygen and begin to die.
Furthermore, you cause severe crush injuries to the dorsal nerve. Men who crank these devices up experience severe numbness, heavy internal bruising, and can permanently destroy their sensation and erectile function.
That is horrifying.
More tension is not better, it is structurally destructive.
So traction devices are essentially the mechanical physics of penile health. It's external force remodeling internal tissue.
Exactly.
But what happens when we abandon external force entirely and look at the absolute cutting edge of cellular biology?
We are moving into the realm of modern regenerative medicine and cosmetic enhancements.
The cutting edge is shifting away from mechanical stretching and moving toward leveraging the body's own innate healing mechanisms.
Specifically, we are looking at platelet-rich plasma or PRP therapy, commonly marketed in this arena as the P-shot.
A February 2024 study in the Journal of Sexual Medicine really caught my eye on this.
It's a great study.
And this study is vital because they didn't look at men with Peyronie's or severe erectile dysfunction. They look at healthy guys.
Right. The average age was around 30, no previous medical issues, just men looking for functional and cosmetic enhancement.
The clinical methodology of PRP is fascinating. Walk us through it.
The clinician begins with a simple blood draw from the patient's arm.
Okay, standard blood draw.
That blood is placed into a centrifuge, which spins it at high speeds to separate the red blood cells from the plasma.
So it isolates the good stuff.
This isolates the platelet-rich plasma, which is incredibly dense with the body's own natural growth factors and cytokines.
And then what?
Then, utilizing an ultrasound machine to ensure precise targeted placement, the clinician injects this concentrated PRP directly into the corpus cavernosum, the two primary erectile cylinders inside the penis.
Okay, so you are injecting a super concentrated serum of your own blood back into the tissue. What are those growth factors actually doing on a microscopic level?
They trigger a process called angiogenesis.
Angiogenesis?
Angiogenesis is the physiological process through which new blood vessels form from pre-existing vessels.
Oh, wow.
By flooding the erectile tissue with growth factors, you are signaling the body to build new, healthy vascular networks and regenerate the smooth muscle tissue.
You are fundamentally upgrading the plumbing.
Exactly, upgrading the plumbing.
And the results from this specific 2024 study were really compelling.
Yeah.
They documented an average length increase of 0.8 inches and a girth increase of 0.47 inches.
Which is measurable.
But beyond the measurements, every single patient reported improved overall functional quality, meaning harder, more reliable erections.
The appeal of autologous PRP is profound.
Because it utilizes your own biological material, right?
Exactly. The risk of an allergic reaction, immune rejection, or foreign body response is virtually zero. You aren't introducing synthetic chemicals and you aren't using a scalpel.
You were simply taking your body's own cellular construction crew, multiplying them, and deploying them exactly where you want enhanced vascularity and tissue health.
Along those same regenerative lines, shockwave therapy is gaining massive traction.
And again, the name sounds brutal, shockwave, but it's actually acoustic waves, right?
Correct. Low-intensity extracorporeal shockwave therapy utilizes targeted acoustic sound waves to create controlled microtrauma inside the erectile tissue.
Like tiny vibrations.
Yes. Just like PRP, this microtrauma triggers the body's natural healing cascade, specifically stimulating angiogenesis to build new blood vessels and break down microplaques.
So it's entirely non-invasive and focuses on upgrading the core vascular health. So PRP and shockwave therapy are about building genuine, functional vascular tissue. But that is vastly different from cosmetic fillers, which is another massively popular but entirely different route.
Yes, we need to distinguish these.
Let's talk about fillers, because this is where the risk profile changes dramatically and things get incredibly dangerous.
Fillers do not improve function, they simply occupy space. They fall into two distinct categories: absorbable and non-absorbable.
Okay, let's start with absorbable.
The most common absorbable filler used clinically is hyaluronic acid, or HA.
I've heard of that for skincare.
Yes, this is the exact same biocompatible substance used in facial fillers for lips or cheeks.
HA is naturally occurring in the human body, so the immune system usually tolerates it. And injecting HA under the skin to the penile shaft can add a significant 2 to 3 centimeters of girth.
It can.
But it's an illusion with an expiration date. It lasts maybe 12 to 18 months before the body naturally breaks it down and absorbs it.
It is temporary, but when performed by a board-certified professional in a sterile environment, it is generally considered medically safe.
Okay, but what about the non-absorbable ones?
The grave life-altering danger lies in the second category, non-absorbable fillers. We are talking about PMMA, polymethyl methacrylate, or industrial silicone.
This is the black market stuff. You go on internet forums, and there are guys trying to figure out how to do this cheaply, sometimes injecting it themselves. It is absolute madness.
It is clinically catastrophic. When you inject industrial silicone or PMMA into the body, the immune system immediately identifies it as a massive hostile foreign invader.
But it cannot break it down.
Right. So the body launches a perpetual massive immune response, creating severe permanent inflammatory damage. The tissue tries to wall off the silicone, forming hard, painful nodules called granulomas.
It essentially turns the tissue into a bumpy, hardened mess.
Exactly. The silicone often migrates, destroying the delicate vascular network. This leads to severe, permanent erectile dysfunction, chronic agonizing pain, and tissue necrosis.
And how do they fix that?
Yeah.
Can they fix it?
The only treatment at that stage is horrific reconstructive surgery, where urologists have to physically flay open the anatomy and scrape the hardened silicone out of the tissue, leaving permanent disfigurement.
Oh my God.
Under absolutely no circumstances should non-absorbable fillers ever be used.
That is a stark, non-negotiable medical warning. Stay away from silicone.
Please do.
And while we are on the subject of extreme cosmetic procedures, I have to bring up a surgery that blew my mind. It sounds like a logical idea until you actually understand the biomechanics.
You're talking about the suspensory ligament release.
The suspensory ligament release, yes.
This is a highly controversial cosmetic surgery.
How does it supposedly work?
The clinician physically severs the suspensory ligament, the tough band of connective tissue that anchors the base of the penis deep to the pubic bone.
Okay.
The mechanical theory is that by cutting this anchor, the internal portion of the penis slides forward and drops down, making it appear longer externally.
But wait, how is this even legally performed? If you sever the primary anchor, you completely destroy the structural integrity of the organ.
You do.
And the data shows it only adds flaccid length. It adds absolutely zero length when erect.
That is the tragic reality. The biomechanical cost is devastating. That suspensory ligament exists specifically to provide structural stability and the upward pointing angle during an erection.
So if it's gone.
When you completely sever it, the erection loses its foundation. It becomes dangerously unstable, pointing downward between the legs, making intercourse physically awkward, painful, or practically impossible.
That's terrible.
Furthermore, as that severed ligament attempts to heal, it generates massive massive amounts of scar tissue.
And scars contract, right.
Yes, that scar tissue often contracts as it matures,
Yeah.
violently pulling the anatomy back inward, frequently making the penis look significantly shorter than it did before the surgery.
It is a massive, catastrophic gamble. You are risking permanent structural instability and disfiguring scar tissue for maybe an inch of flaccid visual length.
This raises an important question about risk versus reward.
Exactly. Why? Why undergo a high-risk, potentially destabilizing surgery or inject dangerous fillers to alter a physical trait that, as the 52,000-person survey showed, 85% of partners do not deeply care about?
It is the ultimate paradox of this entire medical field. Men are risking permanent nerve damage with overtension traction devices, tissue necrosis with silicone, and structural ruin with ligament surgeries, all to satisfy a metric that the people they actually want to be intimate with do not deeply value.
Which brings us to a profound stepping back point. We have explored the extreme anatomy of a 14.5-inch outlier, the mental health crisis of dysmorphia, mechanical traction braces, and cellular injections.
We've covered a lot of ground.
We have to ask the ultimate question. Why are human beings hardwired to care so deeply about this specific piece of anatomy?
It's a great question.
And biologically speaking, what actually creates a satisfying intimate life for both partners? Let's dive into the evolutionary biology.
From an evolutionary standpoint, the biological context is fascinating. Compared to the rest of the animal kingdom, humans actually possess the largest penises of any primate, both in absolute measurement and relative to total body proportion.
Wait, we beat out gorillas.
We do. Consider a silverback gorilla,
Hmm.
a massive, incredibly powerful animal that possesses a comparatively tiny penis, roughly 1.5 inches long.
Okay, so why did early hominids branch off and evolve this dramatically different structure? What was the evolutionary pressure?
Evolutionary biologists point heavily to the semen displacement theory.
The semen displacement theory. Okay, what is that?
For millions of years of our evolutionary history, sexual selection drove our anatomical development. In ancestral, highly competitive mating environments where females might mate with multiple males in a short time frame, reproductive success was a fierce competition.
Right.
The semen displacement theory posits that a longer structure evolved as an internal physical tool.
A tool for what?
Its purpose was to literally plunge into the reproductive tract and scoop out or displace the genetic material, the sperm of rival males, before depositing its own.
Wow.
In that brutal ancestral environment, the longer the structure, the more efficient the displacement, ensuring those specific genes survive to the next generation.
It is a wild, slightly graphic concept,
Yeah.
but from a purely mechanical evolutionary perspective, it makes total sense. Form follows function.
Exactly.
And speaking of our ancient ancestors, there was a fascinating 2013 study that looked at visual attraction.
Yes, the computer-generated images study.
They used computer-generated images of male bodies and asked women to rank their attractiveness based on varying heights, shoulder-to-hip ratios, and flaccid penis size.
Context is key here. For our ancient clothing-free human ancestors roaming the savannah, flaccid size would have been highly visible.
Right, no pants.
It would have played a role in initial, purely visual attraction long before any actual sexual contact occurred.
And the results of the study were incredibly revealing. They found that, yes, flaccid size played a role in visual attraction, but there was a definitive, hard biological limit.
Yes.
Attractiveness ratings increased up to about 7.6 centimeters, or exactly 3 inches, flaccid.
Right.
But after that point, making the anatomy any larger actively diminished the attractiveness rating. It became a negative.
Which is really telling.
Overall, physical fitness and body proportion always won out over one exaggerated specific trait.
Which perfectly aligns with a broader biological principle seen across all species. Over-exaggerated traits are frequently interpreted by the primal brain as a sign of underlying genetic problems, mutations, or instability.
Oh, that makes sense. Like a peacock with too big of a tail.
Exactly. A balanced, highly proportional athletic physique signals excellent metabolic health, strong cardiovascular function, and genetic stability.
So visually extreme size is a negative. But what about physiologically? If we shift from visual attraction to actual physical sexual satisfaction, we have to look at the reality of female internal anatomy.
Yeah.
Because this is where the bigger is physically better. Myth completely biologically falls apart.
It collapses entirely. When we look at female anatomical structures, specifically the distribution of sensory nerves, Extreme length is physiologically irrelevant.
How so?
The highly sensitive area, commonly referred to as the G spot, is located only about one-third of the way into the vaginal canal. It is highly accessible.
Exactly. You do not need deep, extreme penetration to reach the primary centers of internal pleasure.
And even more importantly, we have to differentiate between the nerve pathways.
That is the biological crux of the issue. Vaginal and clitoral orgasms do not operate on the same system.
No, they are triggered by entirely different nerve pathways, such as the pelvic nerve versus the pudendal nerve, and they stimulate entirely different sensory centers in the brain.
Wow.
The clitoris, which is the primary, overwhelmingly dominant center for female sexual pleasure, is external anatomy.
Right.
Therefore, excess internal penile length provides absolutely zero physiological advantage for stimulating it.
All of that extra length, the massive standard deviations we talked about, is essentially bypassing the hardware that actually matters.
Precisely.
So what does this all mean? If evolutionary biology caps visual attractiveness at 3 inches flaccid, and female internal anatomy isn't built to utilize massive length, what actually works?
If you synthesize the data across all these varying fields, the urological studies, the massive psychological surveys, the evolutionary biology, and the anatomical realities, the conclusion is unanimous.
What is it?
The highest predictors of a deeply satisfying sexual life have absolutely nothing to do with measurements in centimeters or inches.
Nothing at all.
The true, verified predictors are clear communication, a generous and enjoyable personality, mutual confidence, and adequate attentive foreplay.
Which brings this entire conversation full circle right back to Matt Barr, the man navigating life with a 14.5-inch extreme outlier.
Yes, his story is so relevant here.
His reflections on his own intimate life were so incredibly poignant. Because his extreme anatomical size completely prevents simple traditional penetration, he couldn't just coast on his hardware. He had to learn to adapt.
He had to become an absolute master of immense patience.
Of extensive, highly attentive foreplay, and of deep, constant communication to ensure his partners were safe and comfortable.
His anatomical outlier forced him to heavily develop the specific behavioral and interpersonal skills that actually drive human satisfaction.
The irony is deeply beautiful.
Yeah.
He became a vastly better, more attentive, more emotionally connected partner, not because of his extreme size, but because he had to completely overcome the severe limitations his size imposed on him.
Exactly.
His hardware was so extreme it was essentially useless, so he had to completely master the software.
He had to completely master the software. That is perfectly stated.
And that brings us to the close of this deep dive. We have journeyed through an immense landscape of medical and psychological reality.
We covered a lot today.
We started with the mathematical clinical truth of global averages, that highly functional 5.2-inch baseline, and moved to the extreme logistical and psychological tolls of the ultimate outliers.
We've looked closely at the hidden realities of dysmorphia.
The cellular magic of repairing a buried penis through cardiovascular fitness, the mechanical remodeling of mechanotransduction, and the bleeding-edge science of tissue regeneration with PRP and shockwave therapy.
And through all of it, the core lesson is that the human body is not a static measuring stick.
It really isn't.
It is a living, incredibly responsive ecosystem. It responds to the food we eat, the cardiovascular exercise we perform, the mechanical tension we apply to it, and perhaps most importantly, the intense psychological stress we internalize.
I want to leave you, the listener, with a final provocative thought to mull over.
Okay, let's hear it.
As we look at the horizon of medical science, regenerative medicine therapies like PRP, targeted shockwave therapy, and eventually custom stem cell treatments is only going to advance exponentially.
It is moving incredibly fast.
We are rapidly approaching a future where treating erectile function and perhaps even safely altering physical dimensions at a cellular level will become as routine, accessible, and devoid of risk as visiting your dentist to get your teeth cleaned.
That is undeniably the trajectory of the science. But if that day arrives, if medical science can eventually give every single person the exact physical dimensions they think they desperately want with zero risk, it raises a profound philosophical question.
Yeah.
When the physical variance is completely removed, when everyone has the perfect hardware, will it finally force society to admit that human intimacy was never really about the hardware to begin with?
Wow.
Will we finally realize that true, profound connection is entirely reliant on the software, our minds, our deep empathy, our communication, and our ability to be truly present with another human being?
It's going to be absolutely fascinating to watch that cultural shift happen because right now, so many people are still frantically searching for an X-ray machine, hoping to find a clear, binary, easily measurable answer to a complex question of intimacy.
They are looking in the wrong place.
But as we've seen today, the muddy, deeply interconnected waters of human biology and psychology are where the real truth actually lives. Thank you so much for joining us on this deep dive. Keep questioning the world around you, keep looking past the surface illusions, and we'll catch you on the next one.